Hello, I'm Dr. John Daly, Chief Medical Officer of COLA. It is a great pleasure to talk with you during this Patient Safety Week. Since the inauguration of clear regulations of laboratory, COLA has been in the forefront, advocating for patient safety in our laboratories. Every day, thousands of patients put their trust in all of us in the clinical laboratory to provide them with optimal laboratory medicine. It is a great responsibility and one which we should not take lightly. The Institute of Medicine has a long history of alerting us to errors in the delivery of medical care and offering potential solutions to improving the quality and safety. In 2000, they published To Err is Human, followed in 2001 with the seminal publication of Crossing the Quality Chasm. Most recently, they published Improving Diagnosis in Healthcare, which discussed diagnostic errors which persist throughout all settings of healthcare and continue to harm an unacceptable number of patients. The document concluded that improving diagnostic processes is not only possible, but also represents a moral, professional, and public health imperative. In 2016, the British Medical Journal published an analysis of all deaths in the United States and found medical errors to be the third leading cause of death here in the U.S. The clinical laboratory is not immune to errors. Errors occur in the laboratory and can have a fatal outcome. Consider the cross-matching of a blood specimen and the transfusion of incompatible blood to a patient. In fact, the College of American Pathologists has reported in two quality studies, one in 2010 and the other in 2016, that a greater than 1% error rate occurs in the blood bank. In the 1970s, Dr. George Lundberg, a pathologist, introduced the concept of the brain-to-brain loop for laboratory testing. The first step is the clinician determining which laboratory studies are indicated. Many intermediary laboratory steps are then performed in the pre-analytic phase of testing, that is, before the specimen arrives in the laboratory. The analytic phase occurs when the testing is actually performed, and the post-analytic phase is where steps are taken to deliver the test results to the clinician. The pre-analytic phase of patient testing is the most prone to error because of the multiplicity of steps, the number of different individuals handling the specimen, and the variation in work environment that are encountered. These begin at the bedside and they culminate in the specimen arriving to the site of testing in the clinical laboratory. In some studies, as high as 68% of laboratory errors occur in the pre-analytic phase of testing. It is important for us to remember that patient or specimen misidentification during the pre-analytic phase of testing will follow throughout the entire testing process, potentially culminating in results being reported on an incorrect patient. The second most common area for errors occurs in the post-analytic phase of testing, and the analytic phase has the least number of errors, which much of this being due to the improvement in technology that have occurred over the past 40 years. Laboratory errors can have major effects on patient outcomes, with additional tests being ordered, inappropriate treatment, unneeded imaging studies, more invasive testing, unnecessary consultation, litigation, and we must keep in mind, laboratory errors can have a financial, but more importantly, an emotional toll on the patient. So as we celebrate Patient Safety Week, we need to keep in mind that medicine has much to do before we achieve the level of safety we want for our country and for our patients. In our laboratory, we must be ever vigilant to provide high-quality, error-free laboratory testing. As I said at the outset, every day thousands of patients put their trust in all of us in the clinical laboratory to provide them with optimal laboratory medicine. It is a great responsibility and one which we should not take lightly. Thank you for your attention.